Cardiologist warns, millions do this every morning without knowing the risk. At the precise moment of 6:15 a.m., James awoke, experiencing what he perceived as a state of perfect well-being. His blood pressure was meticulously managed, all his routine medical examinations were current, and his commitment to daily walks underscored a life seemingly dedicated to health. Yet, a mere 3 hours later, at 9:30 a.m., a sudden and massive cardiac collapse plunged him into a desperate medical emergency, with paramedics rushing him to the nearest hospital. The stark contrast between his initial feeling of perfect health and the subsequent life-threatening event begs a critical question. What transpired in those intervening 3 hours to transform a robust 72-year-old man into a critical medical patient? The revelation promises to be profoundly shocking, precisely because countless individuals, perhaps even you, are inadvertently committing the identical, potentially fatal error each morning, unknowingly venturing into perilous territory. This wasn't a consequence of his diet, nor was it attributable to overwhelming stress or even an unfortunate genetic predisposition. Instead, the culprit was a seemingly innocuous 30-second habit, one that millions observe with an almost religious devotion under the misguided belief that it contributes to their health, but which could tragically claim your life as early as tomorrow morning if you remain unaware of the crucial information about to be disclosed. If you find yourself in the demographic over 60 years of age, it is imperative that you halt all other activities immediately and dedicate your complete and undivided attention, as the insights presented herein could literally demarcate the line between a normal, peaceful awakening tomorrow and your family receiving the most profoundly desperate and life-altering call of their existence. Within the medical community, cardiologists have identified a precarious period they term the morning danger zone, specifically encompassing the hours between 6 a.m. and 10 a.m., during which the incidence of fatal cardiac events surges dramatically by an alarming 40% when compared to any other segment of the day. James, like so many others, was utterly oblivious to this critical window of vulnerability. It's highly probable that this vital piece of information was unknown to you as well. However, armed with this newfound knowledge, every fleeting second you continue to engage with this message possesses the potential to profoundly safeguard your life, as the precise nature of the mistake that brought James to the precipice of death will be unveiled, alongside comprehensive strategies for its complete avoidance. The underlying factor that transforms these early morning hours into a veritable cardiovascular minefield is a meticulously orchestrated physiological storm that erupts within your body the very instant your eyes flutter open. Your biological system does not merely activate with the gentle flicker of a light bulb. Rather, it detonates with the sudden, jarring force of an engine that has endured a freezing night. Initially, your intricate circadian rhythm acts as a biological trigger, unleashing a torrent of cortisol, the quintessential stress hormone. This potent chemical then violently accelerates your heart rate and aggressively constricts your blood vessels, setting the stage for heightened cardiovascular strain. Concurrently, your nervous system undergoes a brutal, instantaneous transition from a state of restful repose to one of intense fight or flight, inundating your system with adrenaline, which further amplifies both blood pressure and heart rate to alarming levels. Furthermore, after enduring a prolonged period of 7 to 8 hours without any fluid intake, your body invariably succumbs to dehydration, rendering your blood alarmingly viscous, much like thick honey. This significantly impedes its flow, compelling your heart, an organ that has perhaps toiled tirelessly for 60, 70, or even 80 years, to exert itself 3 times harder just to maintain circulation. Envision your aging heart, already bearing the immense cumulative workload of decades, now confronted by this multifaceted morning storm, and then, at this precise apex of physiological vulnerability, you inadvertently commit a critical error that can push it irrevocably beyond its functional limits. James made this very mistake, and it is highly probable that you too are engaging in similar practices. Indeed, a pervasive analysis reveals that there are 5 distinct deadly mistakes routinely committed by individuals over the age of 60 during these critical early morning hours, and it is tragically likely that you are currently making at least one of them. Among these, the 5th mistake, the very one that brought James to the brink of death, stands out as the most perilous of all. It is absolutely imperative that you remain attentive until the very end, as your life could, quite literally, hinge upon this crucial information. The first profound error that propels countless individuals directly into hospital emergency rooms each morning is an action so fundamentally ingrained and normal in daily routines that an astonishing 95% of people fail to recognize its inherent danger. This involves abruptly propelling oneself out of bed the very instant the alarm clock shatters the morning silence. You open your eyes, the shrill ring pierces your consciousness, and without a moment's hesitation, you catapult from a supine position to an upright stance, much like a soldier reflexively responding to an urgent command. This rapid transition appears innocuous, perhaps even commendable, a testament to an energetic start to the day. However, for individuals beyond the age of 60, this seemingly simple act can precipitate a devastating physiological event known as orthostatic hypotension. This phenomenon manifests as a sudden and significant drop in blood pressure upon standing, which can trigger catastrophic falls, episodes of profound fainting, and, in its most extreme and alarming manifestations, can serve as the direct catalyst for perilous cardiac arrhythmias that can prove fatal within minutes. Let us delve into the intricate physiological cascade that unfolds within your body when you unceremoniously launch yourself from bed without a gradual transition. During the prolonged period of 7 to 8 hours spent in a horizontal lying position, your blood volume is distributed relatively evenly throughout your entire circulatory system. The precise second you abruptly assume an upright posture, the immutable force of gravity instantaneously pulls a substantial volume of blood, potentially up to 1 liter, downwards into the capacious veins of your legs and abdomen. This sudden displacement means that significantly less blood is immediately available to return to your heart for pumping, and consequently, a drastically reduced volume of oxygenated blood reaches your brain. In younger, healthier individuals, highly responsive pressure sensors, medically termed baroreceptors, located within your arteries, detect this swift change instantaneously. These sensors then dispatch urgent alarm signals to your brain, which, in turn, issues immediate commands to your heart to accelerate its beating rhythm and to your peripheral blood vessels to constrict, thereby rapidly compensating for the sudden drop in pressure. The young individual often remains entirely oblivious that this rapid corrective physiological dance has even occurred. However, as the body ages, these crucial baroreceptors gradually become less sensitive and markedly slower in their response. The heart's ability to swiftly accelerate is diminished, and during these critical, fleeting seconds, blood pressure plummets, leaving the brain deprived of adequate oxygen supply. The ensuing symptoms are not only terrifying, but inherently dangerous. Severe, disorienting dizziness, blurred or tunnel vision, the unsettling sensation of seeing flashing stars, and in the most severe and perilous scenarios, a sudden, debilitating faint that inevitably leads to a catastrophic fall. Falls represent one of the predominant causes of hospitalization and death among older adults, and a significant proportion of these incidents occur for precisely this reason: individuals collapsing in the immediate minutes after rising from bed. The inherent danger extends far beyond the direct impact of the fall itself. Firstly, the injuries sustained, such as traumatic brain injury or a devastating hip fracture, often necessitate prolonged periods of immobilization, which, in turn, massively escalates the risk of developing life-threatening complications like lung clots, pulmonary embolisms, and pneumonia, both of which possess a high potential for fatality. Secondly, the body's eventual and often delayed response to this precipitous drop in pressure can prove even more perilous. When the autonomic nervous system finally awakens to the emergency and registers the critical blood pressure deficit, it reacts with a sudden, compensatory fury, triggering reflex tachycardia, a rapid and violent acceleration of heartbeats in an organ already grappling with the inherent stress of the morning hormonal storm. This treacherous combination of a sudden, drastic drop in pressure swiftly followed by a violent cardiac acceleration can be the critical trigger for the onset of fatal arrhythmias in hearts already rendered vulnerable by age or underlying pathology. The surprisingly simple, yet absolutely vital solution to meticulously avoid this first deadly mistake is as follows. When your alarm signals the start of the day, resist the urge to immediately rise. Instead, remain in a recumbent position for a minimum of 30 to 60 seconds. During this brief period, consciously take 5 deep, deliberate breaths to signal to your body that there is no imminent emergency and to gently begin regulating your autonomic nervous system. Subsequently, with slow and measured movements, sit up on the edge of your bed, ensuring your feet are firmly planted on the floor, and maintain this seated posture for an additional 60 seconds. While seated, gently rotate your ankles in slow circular motions. This simple action effectively activates the muscle pumps within your calves, which play a crucial role in assisting the return of blood to your heart against the pull of gravity. Only after completing these preparatory steps should you then slowly and cautiously stand up, pausing for a few more seconds to ascertain the absence of any dizziness or instability. These additional 2 to 3 minutes, seemingly insignificant in the grand scheme of your day, could genuinely represent the pivotal difference between a safe, uneventful awakening and the jarring, desperate arrival of an ambulance at your doorstep. Does this sound like an overstatement? Thousands of individuals discover, often tragically and irrevocably, that it is not. The second deadly mistake, practiced by millions of individuals every morning, is so deceptively simple, it almost verges on the ridiculous. Yet it holds the profound potential to delineate the boundary between an ordinary, healthy day and a sudden, catastrophic cardiovascular emergency. This mistake is the failure to prioritize drinking water as the very first action upon waking. The prevailing habit sees most people immediately diverting their attention to reaching for their morning coffee, hurrying to the bathroom, or instinctively checking their cell phones, utterly disregarding the undeniable fact that their bodies have diligently spent the preceding 7 to 8 hours continuously losing fluids through the imperceptible processes of breathing and perspiration. This sustained nocturnal fluid depletion inexorably leads to a state of dehydration, which, in turn, transforms their blood into a dangerously viscous, slow-moving substance. This seemingly harmless oversight is, in truth, one of the most lethal of morning habits, as it meticulously sets the perfect physiological stage for any subsequent cardiovascular stressor, be it the abrupt cold shock of a morning shower or the physical effort of standing up too quickly, to become the ultimate trigger for a devastating cardiac collapse. During the entirety of your sleep cycle, your body remains a hub of vital biological activity, with countless processes ceaselessly operating, each demanding a continuous supply of water. You continuously exhale water, vapor from the depths of your lungs with every breath. Your skin diligently perspires to meticulously regulate your core body temperature, and your kidneys tirelessly continue their essential work of filtering blood and producing urine. After 7 to 8 uninterrupted hours of these fundamental processes occurring without any fluid replenishment, your body inevitably enters a state of hemoconcentration, a critical physiological condition characterized by a drastic reduction in the liquid volume of your blood, while the absolute number of blood cells remains constant. The alarming consequence of this is blood that attains the consistency and thickness of honey, compelling your heart to expend an astonishing 3 times more effort just to propel this sluggish, concentrated fluid throughout your circulatory system. Visualize, if you will, the arduous task of attempting to pump honey through an array of delicate, thin straws. This vivid analogy precisely illustrates the immense and entirely avoidable overload you are imposing upon your heart each morning when you neglect immediate rehydration. Beyond the sheer difficulty it presents for pumping, viscous blood is also dramatically more prone to the formation of fatal clots. When blood is abnormally thick, its constituent platelets and red blood cells become considerably stickier and aggregate more readily, dramatically increasing the ease with which thrombi, blood clots, can form and subsequently completely occlude coronary arteries, leading to catastrophic blockages. In contrast, within a normal, freely flowing blood environment, minor damage to arterial walls is typically repaired without incident. However, in the presence of thick, sticky blood, platelets excessively pile up at the site of even minor injury, forming clots that can rapidly proliferate until they obstruct the artery entirely. This, in essence, is the precise mechanism by which an acute myocardial infarction, commonly known as a heart attack, unfolds. It is far from coincidental that the vast majority of heart attacks statistically occur during the early morning hours, a period when the blood reaches its peak state of viscosity. The confluence of abnormally thick blood with the concurrent morning hormonal storm creates an exquisitely dangerous situation of maximal cardiovascular risk, primed to explode with any additional trigger. When you awaken with this dangerously viscous blood and then immediately expose yourself to any form of stress, be it physical exertion, thermal shock, or emotional duress, you are inadvertently creating the perfect conditions for an imminent cardiovascular catastrophe. The peak release of cortisol and adrenaline during awakening further exacerbates this by elevating blood pressure, forcing this thick blood through your arteries with even greater, more damaging force. Should there be any pre-existing, unstable cholesterol plaque within your coronary arteries, this additional pressure can cause a fragment of that plaque to dislodge. In a healthy, fluid blood environment, this might constitute a minor, manageable event. However, in the context of thick, sticky blood, platelets swiftly and aggressively accumulate around the dislodged fragment, rapidly forming a thrombus that can grow exponentially within minutes until it completely blocks the blood flow to a critical section of the heart muscle. The remarkably simple, yet potentially life-saving solution to circumvent this potentially fatal mistake is to establish a proactive habit. Prior to retiring for the night, always place a glass of room temperature water on your bedside table. Upon waking, make immediate hydration your absolute, unequivocal first priority before even considering checking your phone, before heading to the bathroom, before anything else. Consume a minimum of 250 to 300 milliliters of this room temperature water. This deceptively simple act of drinking water immediately initiates the reversal of nocturnal hemoconcentration, rendering your blood more fluid and dramatically alleviating the immense overload placed upon your heart. In a matter of mere minutes, you are quite literally diluting the danger, thereby establishing significantly safer cardiovascular conditions to navigate the remainder of your morning. It is a mere 30-second habit that possesses the astonishing potential to add decades of healthy life. The third deadly mistake, a pervasive habit contributing significantly to morning cardiac collapses, is something an astonishing 80% of the population practices with unwavering regularity, under the firm conviction that it is absolutely essential for morning functionality. This refers to the act of consuming strong coffee, particularly potent espresso or highly concentrated brewed coffee, on a completely empty stomach immediately upon waking. This seemingly innocent ritualistic habit is, in actuality, a formidable cardiovascular bomb camouflaged within the guise of a morning routine. Its danger lies in its potent combination of the devastating effects of high concentration caffeine with a completely empty digestive system and an organism already profoundly overwhelmed by the body's natural hormonal storm of awakening. Caffeine, a powerful central nervous system stimulant, instantly triggers a further significant release of adrenaline, which in turn dramatically accelerates heart rate and precipitously elevates blood pressure with sudden and intense force. This surge occurs at the precise juncture when your heart is already struggling against the combined physiological onslaught of elevated cortisol, blood rendered thick by overnight dehydration, and the abrupt, jarring transition from the profound state of sleep to full wakefulness. For a young, robust, and healthy heart, this stimulating overload might be marginally tolerable. However, for a cardiovascular system that has diligently performed its duties for many decades, characterized by arteries that have naturally lost some of their youthful elasticity, this synergistic combination of intense stimuli can serve as the ultimate precipitating push that leads to dangerous arrhythmias, severe hypertensive peaks, sudden, dangerously high blood pressure spikes, or even acute, sudden heart attacks. The intricate mechanism by which coffee consumed on an empty stomach escalates into a dangerous practice for mature individuals involves a complex cascade of physiological effects that mutually amplify each other in a potentially lethal feedback loop. When caffeine is consumed on a completely empty stomach, its absorption into the bloodstream is dramatically accelerated, rather than being gradually released and metabolized over a more extended period of 30 to 60 minutes, as would typically occur if food were present in the stomach to buffer its absorption. Caffeine rapidly reaches peak blood levels in a mere 15 to 20 minutes. This rapid surge creates what can only be described as a caffeine shock, instantaneously bombarding the cardiovascular system with an intense and overwhelming barrage of stimuli. This sudden, sharp peak of caffeine profoundly affects the brain by blocking adenosine receptors, which are normally responsible for promoting relaxation and modulating excitatory neurotransmitters. In doing so, it unleashes massive quantities of adrenaline and noradrenaline, directly activating the sympathetic nervous system, a system that is already in an overactive state due to the inherent physiological demands of morning awakening. The cumulative result is an alarming overlap of multiple compounding stimuli that can elevate systolic blood pressure by a staggering 20 to 40 points within a matter of minutes, accelerate heart rate to dangerously high levels, and induce a state of profound cardiovascular hyperexcitability, wherein any additional stressor can trigger catastrophic events. For individuals with undiagnosed or silent coronary artery disease, or those with unmanaged hypertension, conditions that are extraordinarily prevalent after the age of 60, this early morning stimulating overload can, quite literally, represent the final stressor that causes an arterial plaque to rupture, precipitates life-threatening ventricular arrhythmias, or triggers hypertensive crises that demand immediate emergency medical intervention. The situation is further compounded and becomes even more perilous when one considers that coffee consumed on an empty stomach also significantly interferes with the body's natural mechanisms for blood glucose regulation, thereby creating a state of metabolic instability that imposes additional severe stress on an already overburdened cardiovascular system. Caffeine stimulates the liver to release glucose reserves through the activation of additional stress hormones. However, without the stabilizing presence of food in the stomach to moderate metabolic processes, this stimulation leads to sharp, erratic spikes and subsequent drops in blood sugar levels. This forces the pancreas to labor in overdrive and generates hormonal fluctuations that further exacerbate the stress on the heart. Simultaneously, ingesting caffeine on an empty stomach dramatically increases the production of gastric acid to levels that can cause severe irritation, persistent reflux, and even the formation of ulcers in susceptible individuals. There is a direct, recognized connection between chronic digestive problems and the occurrence of cardiac arrhythmias mediated by the vagus nerve, which forms a vital conduit linking the stomach directly to the heart. When the stomach lining is acutely irritated by an excess of acid and caffeine, it can transmit erratic and disruptive signals via the vagus nerve, thereby disturbing the natural, synchronized rhythm of the heart, particularly in older individuals whose autonomic nervous system tends to be less stable and resilient. This complex interplay of metabolic instability, digestive irritation, and excessive nervous system stimulation culminates in a chaotic physiological environment where the heart is simultaneously assailed by multiple, profound stressors, any one of which can culminate in sudden and potentially fatal cardiovascular events. Furthermore, there exists an even more insidious aspect of morning coffee consumption on an empty stomach, an element that the vast majority of people never fully consider. The gradual development of caffeine tolerance and psychological dependence over years often leads mature individuals to progressively increase their intake of caffeine to achieve the same desired stimulating effect, thereby initiating a dangerous escalation that can subtly lead to a state of caffeine intoxication, deceptively disguised as a normal, everyday morning necessity. Many individuals over the age of 60 routinely consume between 400 to 600 milliliters of caffeine in the early morning hours alone, through multiple strong cups of coffee, concentrated espresso shots, or popular energy drinks, without ever realizing they are approaching toxic levels that can induce severe arrhythmias, acute hypertensive crises, and, in extreme cases, even seizures. What renders this particular situation exceptionally dangerous is that the classic symptoms of caffeine excess, palpitations, tremors, heightened anxiety, and even difficulty breathing, are frequently dismissed by individuals as mere normal morning nervousness or an unavoidable consequence of everyday stress. In stark reality, these manifestations can be critical warning signs indicating that the cardiovascular system is being pushed precariously beyond its inherent safety limits. Moreover, individuals who are currently taking medications for managing blood pressure, pre-existing heart conditions, or other common senior ailments are often completely unaware that caffeine can interact dangerously with these prescribed drugs, potentially amplifying their effects, critically reducing their efficacy, or creating unforeseen combinations that severely overload the heart and other vital organs. The specific combination of cardiovascular medications with high doses of morning caffeine can generate unpredictable and dangerous fluctuations in both blood pressure and heart rate that prove exceedingly difficult for medical professionals to control and can frequently result in sudden medical emergencies without any prior warning. The comprehensive solution to meticulously avoid this third potentially fatal mistake necessitates a fundamental paradigm shift in one's approach to morning coffee, prioritizing immediate cardiovascular safety far above the instant energy kick that could, quite literally, cost you your life. If you find the notion of a morning devoid of coffee utterly unimaginable, a sentiment shared by most caffeine-dependent individuals, then the pivotal strategy lies in drastically modifying both how and when you consume it to minimize its inherent cardiovascular risks. Firstly, it is absolutely paramount to never consume coffee on a completely empty stomach. Always precede your coffee with something substantial, even if it is merely a banana, a small handful of nuts, or a piece of toast. This simple act of consuming food helps to significantly slow down caffeine absorption and effectively mitigate the sudden, intense blood peak that profoundly overloads the heart. Secondly, make a conscious effort to gradually reduce both the concentration and the overall amount of your morning coffee. Instead of opting for a triple espresso or an exceptionally strong brew, choose more diluted versions and consciously limit yourself to one smaller cup consumed several hours after waking. Thirdly, implement what can be termed a hydration buffer by proactively drinking at least 300 to 500 milliliters of water before even contemplating your first coffee. This ensures that your blood is adequately fluid and that your cardiovascular system is not already unduly burdened by the dehydration accumulated overnight. Fourthly, consider a gradual transition. Replace a portion of your morning coffee with milder alternatives such as green tea, Green tea contains caffeine in significantly lower concentrations and is also rich in beneficial compounds that promote relaxation and contribute to overall cardiovascular stability. Most critically, if you are over 60 and currently prescribed medications for your heart, blood pressure, or any chronic health condition, it is absolutely imperative to engage in a frank and open discussion with your doctor regarding how your morning coffee consumption may be interacting with your medications and potentially creating hidden cardiovascular risks that could be endangering your life every single morning. While the initial transition away from established caffeine habits may prove uncomfortable due to withdrawal symptoms, this discomfort is infinitely preferable to the devastating reality of discovering through a tragic and irreversible event that your seemingly innocent morning ritual was systematically undermining your cardiovascular health and meticulously setting the stage for a catastrophe that could have been entirely averted. The fourth pervasive mistake contributing significantly to morning cardiovascular emergencies is an activity many individuals diligently pursue, firmly believing it to be a pillar of extreme health. This refers to engaging in intense exercise or vigorous physical activity during the immediate few hours after waking up. I am specifically addressing individuals who, upon rolling out of bed, proceed directly to undertake strenuous runs, engage in heavy weightlifting sessions, participate in high-intensity interval training, HIIT workouts, or any form of activity that drastically elevates the heart rate at a time when the body has not yet fully adapted to the waking state. While regular exercise is unequivocally fundamental for maintaining robust cardiovascular health, the precise timing of this activity is an absolutely critical factor, particularly for individuals who are over the age of 60. What might appear to be an exemplary display of discipline and health consciousness can, when executed at the wrong time of day, actually evolve into a perilous recipe for cardiovascular disaster. The fundamental problem lies in the physiological state of your cardiovascular system during these early morning hours. It is already confronting multiple simultaneous stressors. These include elevated cortisol levels, spiking adrenaline, blood rendered thick by overnight dehydration, and naturally higher blood pressure due to the intrinsic fluctuations of circadian rhythms. Introducing intense exercise into this already stressed physiological environment is akin to dousing an intensely burning fire with a fresh supply of highly flammable gasoline. The heart, already working in overdrive to counteract the effects of the morning hormonal storm, is suddenly commanded to pump an even greater volume of blood to rapidly activating muscles. This sudden, massive increase in demand for oxygen can escalate to levels that may become impossible for the cardiovascular system to adequately supply. For a young, resilient heart and elastic, healthy arteries, this sudden overload might be manageable without immediate adverse effects. However, for an aging cardiovascular system, one that has endured decades of wear and tear, this potent combination of hormonal stress compounded by intense physical exertion can become the definitive trigger for the onset of dangerous arrhythmias, myocardial ischemia, insufficient blood flow to the heart muscle, or even acute sudden heart attacks. The situation is further exacerbated and becomes considerably more dangerous when we factor in that many individuals undertake these morning exercise routines while simultaneously fasting and being in a state of dehydration, which dramatically amplifies the inherent risks. Intense physical activity performed while fasting forces the body to resort to breaking down muscle tissue for energy, which in turn releases additional stress hormones and can induce hypoglycemia, low blood sugar, thereby imposing further significant burdens on the cardiovascular system. When combined with the pre-existing dehydration from the night, the dangerously thick blood encounters extreme difficulty in efficiently transporting oxygen to both the active muscles and the heart itself, thereby creating an absolutely perfect storm for a cardiovascular collapse. Numerous tragic cases of sudden death occurring in gyms or during morning runs can be directly attributed to this precise confluence of factors. Apparently healthy individuals who were completely unaware that they were cumulatively stacking multiple severe risk factors into a potentially lethal combination. Furthermore, Intense morning exercise possesses the capacity to unmask silent heart diseases that an individual may have been completely oblivious to possessing. A significant proportion of individuals over 60 years of age harbor some degree of asymptomatic coronary artery disease, characterized by the presence of atherosclerotic plaques within their arteries that typically do not produce noticeable symptoms during normal everyday activities. However, these seemingly benign plaques can swiftly transform into major life-threatening problems when the heart is forcibly compelled to operate at the absolute limits of its capacity. During intense exercise on a morning when the cardiovascular system is already severely overburdened, these partially blocked arteries may prove utterly incapable of providing the additional oxygen that the heart so urgently demands. The dire consequences can include severe ischemia, the precipitation of dangerous arrhythmias, or even the catastrophic rupture of a plaque leading directly to a sudden heart attack. The strategic solution to effectively avoid this fourth mistake involves a deliberate reorganization of both the timing and the intensity of morning exercises, ensuring that your physical activity harmonizes with your body's natural physiology rather than brutally working against it. If your preference is to engage in exercise during the morning hours, it is advisable to wait for a minimum of 2 to 3 hours after waking. This allows your body sufficient time to naturally rebalance itself. During this preparatory period, ensure you drink plenty of water to rehydrate, consume something light to provide a metabolic buffer, and allow the morning's intense hormonal surges to normalize before introducing significant physical stress. Always initiate your exercise session with a very gradual and sufficiently prolonged warm-up, a step that is particularly crucial if you are over 60. Instead of immediately launching into intense exercises early in the day, opt for gentler activities such as moderate walking, stretching routines, or yoga. These activities provide substantial cardiovascular benefits without unduly overburdening an already stressed system. If your preference truly leans towards intense physical exertion, then seriously consider rescheduling these workouts to mid-morning, afternoon, or early evening when your cardiovascular system is typically more stable, better hydrated, and more adequately prepared to meet such demanding physical challenges. Always remember that exercise, while a powerful form of medicine, must be prescribed and administered judiciously. Like any potent medication, its dosage and timing are critical determinants of whether it will prove to be profoundly beneficial or regrettably harmful. The fifth and ultimate mistake, undoubtedly the most devastating of all, was the precise habit that nearly claimed James's life on that ominous morning. It is a practice enthusiastically embraced by millions who fervently believe it to be incredibly healthy, often vigorously promoted by wellness influencers and biohacking gurus, as if it were the veritable holy grail of longevity. This refers to the act of taking an ice-cold shower, indulging in a cold plunge, or subjecting oneself to any form of extreme thermal shock immediately after waking up. James, tragically, had adopted this very habit just 3 months prior, swayed by the myriad of benefits enthusiastically proclaimed across the internet, promises of enhanced energy, improved mood, and a fortified immune system. Every morning, he would meticulously rise from his bed and proceed directly to endure a 2-minute cold water shower, convinced he was making a sound investment in his long-term health. On the fateful morning he almost died, he replicated this exact routine. He woke up, made his way to the bathroom, deliberately turned the shower faucet to its maximum cold setting, and the precise moment the icy torrent struck his chest, his entire cardiovascular system descended into total catastrophic collapse. This was no mere coincidence. It was a predictable and potentially fatal physiological reaction, an inevitable consequence when extreme thermal shock is synergistically combined with an organism already severely overburdened by the intense morning hormonal storm. Let us delve into the terrifying scientific explanation behind what precisely transpires when an individual over the age of 60 is exposed to severe thermal shock immediately after waking. The body, interpreting this extreme extreme cold as a direct and aggressive threat instantly activates all its emergency mechanisms designed to preserve vital core body heat. Within a mere matter of seconds, a phenomenon medically termed massive peripheral vasoconstriction occurs. This involves thousands of minute blood vessels located in the skin and extremities simultaneously constricting, much like floodgates being violently slammed shut. Imagine your intricate cardiovascular system as a vast interconnected network of pipes where suddenly thousands of the smaller peripheral pipes are abruptly and forcefully closed. The pressure within the main circulatory circuit instantly and explosively escalates. Scientific studies conclusively demonstrate that such acute thermal shock can cause systolic blood pressure to surge by a staggering 20 to 40 points within mere seconds. However, for individuals who already contend with elevated blood pressure or possess a compromised cardiovascular system, these pressure increases can be even more extreme and acutely lethal for a heart that has tirelessly performed its duties for many decades, and for arteries that have become hardened and less compliant due to the natural process of atherosclerosis associated with aging. This sudden and massive increase in pressure is analogous to attempting to inflate an old, dried-out balloon far too rapidly. The inherent risk of rupture becomes extraordinarily high, whether it manifests as an unstable cholesterol plaque within a coronary artery dislodging to cause a sudden heart attack, or the catastrophic rupture of a cerebral vessel leading to a hemorrhagic stroke. What renders thermal shock even more profoundly lethal is its dual destructive action. It not only spikes blood pressure to dangerously high levels, but concurrently forces the heart to labor with brutal intensity to overcome the massive cardiovascular resistance that has been instantaneously generated. To propel blood through thousands of severely constricted vessels, the heart must beat with significantly greater force and increased frequency, thereby skyrocketing its oxygen demand to levels that may be utterly impossible to meet, especially if underlying silent coronary artery disease is already present. This condition is exceedingly common in individuals over 60 and frequently presents with no discernible symptoms during normal, everyday activities. When the heart is compelled into this state of extreme oxygen demand at a time when its coronary arteries may be partially obstructed, the inevitable result can be severe myocardial ischemia, a condition that completely destabilizes the heart's electrical system. This is the precise genesis of the most dangerous arrhythmias, particularly ventricular fibrillation, a life-threatening condition where the heart ceases to pump blood in a coordinated, efficient manner, and instead merely quivers chaotically, much like a stalled engine. During ventricular fibrillation, no blood whatsoever is pumped to the brain or to the vital organs of the rest of the body. This is, by definition, cardiac arrest. If not immediately reversed within minutes with the use of a defibrillator, it is invariably fatal. James, tragically, developed precisely this deadly arrhythmia. The extreme thermal shock served as the final, insurmountable push that his cardiovascular system, already profoundly overburdened by the inherent vulnerabilities of the morning danger zone, simply could not withstand. The situation takes on an even more sinister dimension when one recognizes that morning thermal shock is being massively and irresponsibly promoted across social media platforms by influencers who possess not the slightest understanding of the specific and heightened cardiovascular risks pertinent to mature individuals. One frequently encounters viral videos featuring seemingly robust young people and athletes engaging in ice baths, garnering millions of views and, in doing so, creating immense social pressure for everyone to indiscriminately adopt this healthy practice, utterly devoid of any critical warnings regarding the specific risks for different age groups or underlying health conditions. What might be perfectly safe and even beneficial for a 25-year-old athlete with elastic arteries and a young, resilient heart can prove to be quite literally lethal for a 65-year-old individual who has accumulated decades of cardiovascular wear, maintains borderline blood pressure, or silently harbors asymptomatic coronary artery disease. Worse still, many of the enthusiastically promoted benefits such as increased energy and improved mood or immune system strengthening, can be achieved through infinitely safer, less aggressive methods that do not place the cardiovascular system at such a precarious risk of collapse. The modern wellness industry has, regrettably, fostered a culture where more extreme is better, relentlessly encouraging individuals to push their bodies to their absolute limits, as if such exertion were universally beneficial, entirely disregarding the crucial fact that aging organisms mandate different, more cautious, and carefully tailored approaches that work synergistically with their evolving physiology rather than brutally against it. There is also a dangerous psychological component inherent in morning thermal shock that further exacerbates cardiovascular risks. Many individuals who adopt this practice force themselves to tough out extreme discomfort, interpreting it as a testament to their mental fortitude and discipline, thereby dangerously ignoring their body's unequivocal warning signs, such as acute dizziness, alarming palpitations, chest pain, or profound difficulty breathing. James had, regrettably, developed precisely this dangerous mentality. In the weeks preceding his devastating collapse, he occasionally experienced peculiar palpitations and episodes of dizziness during his cold showers, but he tragically misinterpreted these critical physiological signals as signs that his body was adapting and getting stronger, rather than correctly identifying them as dire warnings that he was pushing his cardiovascular system far beyond its safe and sustainable limits. The pervasive no pain, no gain culture can become lethally hazardous when indiscriminately applied to interventions that dramatically stress the heart, particularly in individuals whose cardiovascular capacity is already naturally reduced by the inevitable process of aging. The solution to avoid this fifth and arguably most dangerous mistake is straightforward, yet it possesses the profound capacity to literally save your life. If you are over 60, it is absolutely imperative that you completely avoid all forms of extreme thermal shocks, especially during the initial few hours after waking, a period when your cardiovascular system is already profoundly overburdened and exquisitely vulnerable. If you are genuinely interested in exploring the potential benefits often associated with cold exposure, it is critical to implement them gradually, safely, and never at a time when your heart is already under significant physiological stress. Begin with lukewarm water and progressively, very slowly, reduce the temperature over a period of several weeks or even months. Always direct the colder water first to your extremities, your feet and hands, before allowing it to reach your torso. Under no circumstances should you ever begin with ice-cold jets directed immediately onto your chest. Most importantly, if you experience any cardiovascular symptom whatsoever, be it palpitations, dizziness, chest pain, or shortness of breath, stop the cold exposure immediately and promptly seek a medical evaluation from a qualified healthcare professional. James could very well be alive and healthy today if someone had taken the time to thoroughly explain that his seemingly healthy habit was, in stark reality, meticulously setting the stage for a cardiovascular catastrophe that almost cost him his precious life. Before delving into the specifics of the morning protection protocol, it is absolutely essential to establish a foundation of clarity and transparency, ensuring that you approach this information with realistic expectations and the profound sense of responsibility that your individual health unequivocally deserves. We are, each and every one of us, unique and individual beings, possessing diverse medical histories, distinct genetic predispositions, specific health conditions, particular medication regimens, and cardiovascular systems that respond in entirely disparate ways to any intervention or alteration in daily habits. What may prove to be entirely safe and genuinely beneficial for one person could, conversely, be entirely inappropriate or even dangerously detrimental for another, depending on a myriad of complex factors that can only be adequately assessed and interpreted by qualified health professionals who possess a comprehensive understanding of your specific medical case. The information shared regarding the 5 morning mistakes is meticulously grounded in robust scientific evidence and extensive general clinical experience, but it does not, in any conceivable way, supersede the absolute necessity of a personalized medical evaluation that takes into account your unique and specific health circumstances. If you have any pre-existing medical conditions, such as known heart problems, diagnosed high or low blood pressure, diabetes, pre-existing circulatory disorders, a history of arrhythmias, kidney problems, or any other chronic health condition, it is an absolute imperative that you consult with your doctor before embarking on any significant changes to your established morning routine. Furthermore, if you regularly take medications for any existing condition, especially cardiovascular medications, antihypertensives, diuretics, or drugs that affect heart rhythm, these proposed habit changes can interact in unforeseen and potentially dangerous ways with your prescribed drugs, either potentiating their effects to hazardous levels or conversely critically reducing their efficacy, both of which could have severe consequences. If you are over the age of 70, contend with multiple concurrent health conditions, or possess limited mobility, general recommendations may not be appropriate for your specific situation and unequivocally necessitate adaptation and guidance from a qualified professional. My solemn responsibility in sharing this information is to provide evidence-based educational insights, thereby empowering you to engage in informed and intelligent conversations with your healthcare professionals regarding your personalized care options. Your equally critical responsibility is to utilize this information as a foundational starting point for further medical investigation and discussion, rather than treating it as a definitive, self-prescribed course of action. Should you decide to implement any changes to your morning routine, do so with extreme gradualness, paying meticulous attention to your body's specific responses, and discontinue immediately if you experience any concerning symptoms such as acute chest pain, severe palpitations, extreme dizziness, profound difficulty breathing, or any other unequivocal sign that your body is undergoing excessive stress. It is important to note that not every individual who inadvertently commits the mistakes we have discussed will inevitably develop cardiovascular problems. Similarly, not every individual who diligently implements the suggested corrections will experience immediate or dramatically profound benefits. The overarching goal of presenting this information is to foster heightened awareness and critical education, not to induce undue anxiety or paranoia about normal morning activities. The vast majority of people awaken daily without experiencing serious cardiovascular events, even while making some of these common mistakes, primarily because their cardiovascular systems still possess adequate reserve capacity to effectively handle these transient stresses. However, for individuals situated in higher risk categories, especially those with known cardiovascular risk factors or advanced age, even small judicious modifications in morning habits can profoundly influence the reduction of risks and significantly enhance their overall quality of life. The crucial aspect is to approach any proposed change with common sense, a spirit of moderation, and appropriate medical guidance when deemed necessary. Remember that comprehensive cardiovascular prevention is an intricate and multifaceted process that extends far beyond the initial minutes of the morning. It encompasses a balanced and nutritious diet, regular and appropriate exercise tailored to your aging condition, effective stress management techniques, adequate and restorative sleep, consistent regular medical follow-ups, and unwavering adherence to prescribed medications when medically necessary. Morning habits represent just one crucial piece of the expansive cardiovascular health puzzle, and while modifying them is undoubtedly beneficial, it offers no absolute guarantee against future heart problems. Conversely, ignoring them is not an automatic, unalterable sentence of cardiovascular disaster. Utilize this information as an integral component of a holistic approach to your healthcare, always in collaborative partnership with qualified medical professionals who possess the expertise to adequately assess your individual risks and skillfully guide you towards the most efficacious preventive strategies for your specific case. the profound key to successfully navigating and surviving the treacherous morning danger zone is not merely courage or willpower, but rather an unwavering respect, a deep respect for the delicate and intricate physiological transition your body must undertake from the profound depths of sleep to the full state of wakefulness without unduly overburdening a cardiovascular system that is already inherently grappling with natural hormonal storms. It is precisely for this reason that I meticulously developed what I term the Morning Protection Protocol, a sequence of 5 incredibly simple steps, each requiring merely 1 minute to execute, that collectively and completely transform how your heart approaches the challenges of each new day. These 5 seemingly insignificant minutes, when compared to the 24 hours that comprise a day, are, quite literally, the defining difference between waking up safely and tragically becoming another statistic in the grim tally of morning cardiovascular emergencies. James, having narrowly escaped a fatal experience, now adheres to this protocol with unwavering religious devotion, and hundreds of individuals who have conscientiously implemented these simple yet profoundly effective practices not only report feeling significantly safer, but also testify to experiencing more sustained energy throughout the day, a markedly improved mood, and an amplified sense of empowering control over their precious cardiovascular health. When your alarm clock sounds, consciously resist the ingrained automatic temptation to abruptly leap out of bed like a soldier responding to an urgent emergency. Instead, remain in a recumbent position and dedicate this crucial first minute to consciously and deliberately calming your nervous system as it delicately navigates the transition from the profound state of sleep to full wakefulness. Engage in deep, diaphragmatic breathing through your nose for a measured 4 seconds. Gently hold your breath for another 4 seconds, and then slowly and deliberately exhale through your mouth for 6 seconds. Repeat this complete breathing cycle 5 times. This controlled and rhythmic breathing serves as a powerful physiological signal to your body, indicating that there is no genuine emergency, helping to modulate the release of both cortisol and adrenaline, and effectively delivering a gentle, reassuring good morning message to your cardiovascular system, in stark contrast to the abrupt, jarring shock that most people habitually impose upon their hearts. During this initial minute, you can also perform some gentle, controlled movements while still lying down. Slowly rotate your ankles, gently flex and extend your fingers, and softly roll your shoulders. These actions initiate a gradual activation of your circulation without inducing any significant cardiovascular stress. This second step is arguably the single most critical component of the entire protocol. Before you retire for sleep each night, make it an unwavering habit to always place a large glass of room temperature water on your bedside table. Now, in the second minute after waking, slowly and deliberately sit up on the edge of your bed, ensuring your feet are firmly touching the floor, and consume the entirety of that water, at least 300 to 400 milliliters, steadily but without rushing. This deceptively simple act of drinking water immediately initiates the vital process of reversing the nocturnal hemoconcentration, rendering your blood significantly more fluid and thereby removing an immense physiological load from the arduous work your heart must otherwise perform to pump dangerously viscous blood. You are, quite literally, diluting the inherent danger and proactively establishing much safer cardiovascular conditions for the entirety of the morning that lies ahead. It is crucial to consume the water at room temperature, never ice cold, because even very cold water can trigger subtle thermal shocks, which are precisely what we aim to meticulously avoid at this profoundly delicate moment of awakening. Now that you are comfortably seated on the edge of your bed, maintain that position for another full minute. Do not attempt to stand up just yet. This third minute is absolutely crucial for proactively preventing the onset of orthostatic hypotension and for allowing your cardiovascular system ample time to gradually adjust to the change in body position. While seated, continue to make gentle, circular movements with your ankles. This action effectively activates the muscle pumps situated in your calves, which play a vital role in assisting the return of blood to your heart against the pervasive pull of gravity. You can also incorporate some gentle neck and shoulder stretches, but always ensure that these movements remain controlled, fluid, and relaxed. This minute allows your baroreceptors, the critical pressure sensors, to meticulously adjust to the new upright position and ensures that your brain receives an adequate and uninterrupted supply of blood flow when you finally proceed to stand up. Still seated? Utilize this fourth minute to gently and mindfully awaken your muscles and progressively improve your overall circulation through a series of controlled movements that prepare your body for activity without imposing any undue overload on your heart. Slowly turn your head from side to side, then gently lift your shoulders towards your ears and consciously relax them. Stretch your arms gracefully above your head and then gently relax them back down. Conclude with some gentle side stretches, softly leaning to each side. These deliberate movements send oxygenated blood to muscles that have been inactive during sleep, significantly improve general circulation, and begin to prepare your body for more active movement in a gradual, controlled, and ultimately safe manner. Finally, in the fifth minute, you are now fully ready to stand up, but execute this transition slowly and with profound awareness. Stand up slowly. Pause deliberately for a few seconds while standing to ensure that there is absolutely no dizziness or any other signs of instability. Only then walk slowly towards the bathroom or kitchen. Do not run, do not rush. You have meticulously executed a gradual and safe transition from a state of total rest to one of light activity, thereby demonstrating profound respect for the inherent needs of your cardiovascular system. During this final minute, your heart is functioning under significantly safer conditions. It is adequately hydrated. It has been spared thermal or postural shocks. Your muscles are warmed and your circulation is optimized. You have successfully transformed what could have been a moment of maximal cardiovascular risk into a smooth, controlled, and protected transition that prioritizes your safety as an absolute imperative. If you have conscientiously made it this far through this comprehensive exposition, I wish to extend my most sincere congratulations, for this commitment unequivocally demonstrates an extraordinary level of dedication to your cardiovascular safety, a dedication that could, quite literally, make the profound difference between waking up normally tomorrow and tragically becoming another statistic in the devastating annals of morning emergency calls. You are now fully equipped with the critical knowledge of the 5 deadly mistakes that millions of people inadvertently commit on a daily basis, utterly unaware that they are essentially gambling with their very lives. These include the reckless act of jumping out of bed like a rocket, the dangerous oversight of ignoring immediate hydration upon waking, the perilous habit of drinking strong coffee on an empty stomach, the ill-advised practice of engaging in intense exercise immediately after waking, and the most treacherous of all, the thermal shock that brought James to the precipice of death. More importantly, you now possess the invaluable 5-minute morning protection protocol, a meticulously designed sequence of actions that can completely transform how your heart confidently faces each new day. This profound knowledge is not merely abstract medical information. It represents real, actionable power over your own cardiovascular survival, power that can genuinely add healthy, vibrant years to your life. The fundamental difference between diligently implementing this protocol and persistently continuing to make these perilous mistakes can, quite literally, be the critical distinction between enjoying decades of healthy, fulfilling life and facing a desperate life or death emergency call on some random, unsuspecting morning. James tragically discovered this stark reality in the most terrifying way imaginable, but he was blessed with a second chance, a precious gift that not everyone receives. Today, 3 years after his near-fatal collapse, he adheres to these 5 sacred minutes every single morning with unwavering devotion and has, as a result, transformed not only his cardiovascular safety, but his overall quality of life in myriad ways. He experiences more sustained energy throughout his day, enjoys more restorative sleep at night, and most importantly, lives with the invaluable invaluable peace of mind that comes from knowing he is no longer thoughtlessly rolling the dice with his life each morning. You do not have to wait for a terrifying scare to prompt action. You can proactively begin implementing this vital protection tomorrow morning and bestow upon yourself the invaluable gift of extra decades of healthy, vigorous life. If this critical information holds the potential to save your life or the life of someone you deeply cherish, please demonstrate your support by leaving a powerful like, which significantly aids the algorithm in disseminating this vital knowledge to a broader audience of people who may currently be making these deadly mistakes without any awareness of the risks. Subscribe to this channel as I regularly share evidence-based medical information designed to prevent health emergencies before they even have a chance to occur. Turn on notifications so you never miss content that can, quite literally, make the difference between prevention and catastrophe. This type of preventive health education possesses the capacity to save thousands of lives when individuals truly grasp how seemingly small daily habits can exert enormous and often unexpected consequences on their cardiovascular safety. Please take a moment to comment below, honestly disclosing how many of these 5 mistakes you regularly make. There is no judgment here, only a shared opportunity to collectively save lives through increased awareness. Many viewers are genuinely shocked to realize they habitually make 3, 4, or even all 5 of these mistakes daily, but now you possess the crucial knowledge to initiate fundamental change. Also, please share which specific step of the morning protection protocol you intend to implement first tomorrow. I encourage you to read the comments from other viewers, as people often share their personal experiences with morning cardiovascular symptoms and how simple, actionable changes have brought about dramatic, positive differences in their lives. Your own experience might serve as a powerful inspiration for others to take these critical signs seriously and implement protections that could ultimately save their lives. I urge you to share this video urgently with at least 3 people you love. This is especially vital for anyone over 60, anyone diagnosed with high blood pressure, diabetes, or any recognized cardiovascular risk factor. It could be a beloved father who regularly takes morning ice baths, a cherished mother who abruptly jumps out of bed straight into an intense exercise routine, or simply anyone who deserves to know that their seemingly healthy habits could, in reality, be dangerously jeopardizing their life every single morning. James could have died that day if his wife hadn't acted with incredible swiftness and if the paramedics hadn't arrived in the nick of time. You possess the power to prevent someone you love from enduring that terrifying and life-altering experience simply by sharing this life-saving knowledge. Remember, the delicate transition from sleep to full wakefulness represents one of the most physiologically demanding and vulnerable moments of the entire day for your cardiovascular system. Do not underestimate its profound significance. Do not wait for a terrifying scare to compel you into action. Prevention is arguably the greatest act of love and self-care you can perform for yourself and for the precious people who depend on you. Thank you for watching until the very end and for committing so diligently to your cardiovascular safety. Implement the protocol tomorrow morning. Respect your heart, and we will see you in the next video, armed with even more transformative information that can revolutionize your health and profoundly prolong your life in ways you might not yet even begin to imagine.